I am extremely encouraged by your enrollment in this class. We have a full class. It looks like, if I can look through the various degrees that you are seeking, it looks like we have a very diverse class, which makes for great discussions. And that's really how I run my online classes. And I think it's important for you to know that I run my online classes, and I really look for you to be sharing your opinions. I look for you to be interacting with the text and the material, and then interacting with the case studies that I pose, so that we can get some really good dialogue and discussion going. And given the diversity of people, the diversity of background, and the diversity of opinion, I am sure that this is going to be a challenging class in a good way. That is, it's going to push us all to consider ideas and thoughts and perspectives that we may not have considered before. And that's really important. I noticed that we have people going into the medical field, and it's important for people going into the medical field to realize that the patients they're going to deal with are going to have very different ethical perspectives. And as a medical professional, of course, it's not your job, it's not the job of any medical professional to tell someone what ethics they should have, but it is the job of a medical professional during a time of crisis to help someone understand their own ethical perspective better. Because you know that during a time of crisis, we tend to get all caught up in emotions, and there are all kinds of things and so many details, and doctors are saying this and that and the other. And it's easy for patients to lose sort of perspective. And one of the jobs of a nurse, one of the jobs of a therapist, is to help them understand, okay, what are your basic ethical sort of perspectives? What are the basic ethical guidelines that you have sought to follow in your life? And how can we take the complexity of this situation, reduce it to a few very important points, so that then you can take your ethical perspective and make a decision that you feel comfortable with. And that's really important, that medical professionals have that sensitivity to differing ethical perspectives, and that they have been exposed to those ethical perspectives to the point where they can do that without judging, without making someone feel bad for their ethical decision making, without making them feel somehow that they are disappointing those who are in authority. So that's one example of how ethics can be so very important. The goal of this class, and I want to say this from the very beginning, the goal of this class is not to convince you that any one ethical perspective is different than any other ethical perspective. That's not what this class is about. This is a class in an academic institution that is secular. So our goal is not to tell you what is right and what is wrong. You will find in the discussion that I will play devil's advocate, that I will frequently take a different perspective and a different opinion than you. And I do that especially if it seems that all the students are saying the same thing. So I will ask questions, I will raise objections, I will offer counter explanations. None of those are intended to say to you that you are wrong. All of those are intended to get you to think outside the box, to get you to think beyond the ethical constructs that you came into the class with, to expand your understanding of the way in which different people use different ethical models to make ethical decisions. And I think that's really important. In our first case study during the orientation unit, we will be looking at examples of people who have made poor ethical decisions. And it is true, there are people in this world who make poor ethical decisions. But having said that, my experience teaches me that most people want to do the right thing. There are evil people, I believe that, and we're going to be talking about that, and you can disagree with me, but I believe that there are some people who are evil and don't care about doing the right thing. But by and large, I believe most people want to do the right thing. But they define what is right differently. And in that definition of what is right, they may make a very different decision than I would make. But what is important for me as a human being interacting with other human beings, it's important for me not to immediately judge them for their decision. And here, of course, I'm not talking about rapists or murderers or those who obviously are doing evil things. I'm talking about people in complex situations that are not easily reducible to right and wrong. Those gray areas of life. And let's face it, there are a few things in life which are black, a few things in life which are white, and most of life is gray. All right, where the ethical decision-making process is not easy. If all of life was black and white, there'd be no reason to take an ethics course. So my perspective, my approach to dealing with people who make decisions different from myself is to try to understand what are the basic values that are undergirding their ethical perspective. And what I have found over time is that even people who make decisions radically different from the decisions that I would make usually are operating on the basis of a similar set of values, but they are prioritizing those values differently. They are prioritizing the consequences of that decision differently. They are thinking about different deontological imperatives than I would think about deontological imperatives. In other words, they are saying this rule applies, and I am thinking this rule applies. Now, of course, there's no right or wrong there. And that's really helpful, because if I can understand that even people I disagree with are trying to do the right thing, and we don't disagree, they're not evil, except in those rare cases of people who do very evil things. But by and large, most people are good. That's my belief. And most people are trying to do the right thing. But life is complex. And sometimes they make wrong decisions. Sometimes I make wrong decisions. But if somebody's judging me and somebody's pushing me into a corner and accusing me of being immoral and unethical, then what happens psychologically is my walls of defense go up and I defend what I have done, and that closes my mind so I can't reevaluate what I have done and come to a new and better understanding of the correct decision to make. And so often, and it's so sad, in our interactions with other people, we're on attack mode. You're wrong, you're wrong, you're wrong. And that puts them in defense mode. No, I'm right, I'm right, I'm right. And there's no dialogue. So there can be no change. Part of the goal of this class is for us to be able to talk to people who make decisions differently from us and to ask them to explain those decisions without us judging, just to understand. And to find then points of similarity so that we maybe can suggest perhaps there's a different way of thinking about that. Or maybe they will be able to suggest to us that we're too rigid and there's another way of thinking about it. That kind of dialogue creates such positive goodwill between people, and it opens us up to grow. It opens us up to expand. It opens us up to experience new complex situations in which we then can make good decisions. Otherwise, we're backed into a corner. All we're doing is defending our actions. We're not thinking, we're reacting, and we continue to make the same frequently poor decision over and over again. I want to give you the tools in this class to be able to effectively dialogue with others, so that we can move forward as a community, so we can move forward as a group in thinking about the complex situations that confront us in the 21st century. And let's be honest, the ethical decisions that we make on a daily basis are not easy. They're not easy. The ethical decisions that confront us are the most complex humanity has ever faced because of the advances in biomedical research, because of the advances in technological sort of ability, the ability we have to research and to know things about other people, the kind of invasive technology that exists. I mean, all of these things have made ethical decision making so very complex. And it is with a degree of humility, I think, that we enter into this field, this study, seeking to learn different perspectives, seeking to understand the way in which very wise men and women of the past have thought about these issues, so that then ultimately we can develop our own ethical perspective. And I would say in closing that so very few people, in my experience, have developed a consistent worldview. We'll be talking about that in Unit 1. So very few people have truly developed a consistent ethical model for their own decision-making process. They tend to, in one case, use utilitarianism, in another case, use deontology, in another case, use divine command theory, in another case, use ethical egoism, in another case, use feminist perspective. And so there's no unity between their moral worldview. And hopefully this class will give you a chance to think about that and reflect on that in terms of your own person. So that's another goal, is for your own personal growth.